bicarbonate buffer system is one of the most important buffer systems in the body. And I explained earlier, if you remember how when we were talking about the factors that determine the effectiveness of a buffer system, one of the factors we mentioned is that the buffer system with a very high concentration in the blood will make a very good buffer system. And that is one advantage the bicarbonate buffer system has. The bicarbonate buffer system has a very large concentration in the blood. It is actually said to be the most ubiquitous buffer system in the blood because of the sheer concentration which it has in the circulation, compared to other non-bicarbonate buffer systems which are present in a very smaller concentration. Although the bicarbonate buffer system has a pK of 6.1, which is relatively or comparably far from the physiological pH of 7.4. That's the pH of blood. That can be a disadvantage because 6.1 is very far from 6.4 compared to other buffers that have 7.2. But the fact that the bicarbonate buffer system has a very large amount of concentration and is almost present in almost every part of the body, that advantage will overshadow the disadvantage of a lower pKa compared to the pH of the blood. The other thing that the bicarbonate buffer system has is that usually the ratio between the weak acid and the conjugate base is usually in the ratio of 20:1. And you remember that we mentioned that the effectiveness of a buffer system is usually better and more optimal when the ratio is within ratio 1:10 or 10:1. That is the ratio of the weak acid compared to the conjugate base. The bicarbonate buffer system usually tends to have a ratio of 20:1, which may also be a disadvantage. But then the sheer amount of bicarbonate buffer system and the fact that it is present in almost every part of the body dominates, and then it shadows all the disadvantages of a lower pKa and a very high amount of ratio between the weak acid and the conjugate base. So that makes bicarbonate buffer system a very, very important major regulator of acid-base balance. Now, if you look at this equation we talked about earlier, the Anderson-Hasselbalch equation, in terms of the bicarbonate buffer system, the pH is equal to pKa over the log of the conjugate base and the weak acid. Now, this relationship shows that the pH is directly related to or directly proportional to the concentration of bicarbonate, and the pH is inversely proportional to the weak acid, which is the partial pressure of carbon 4 oxide. Now, what that means is that as the amount of bicarbonate increases, the pH will decrease, and as the amount of bicarbonate decreases, the pH will increase. So this shows that the pH has a direct relationship or direct proportionality with the amount of bicarbonate in the system, meaning that the higher the amount of bicarbonate in the blood, the higher the pH of the body. That will tend to lead to alkalinity. And then the reverse or the converse happens for the partial pressure of carbon 4 oxide, which is the weak base component of the bicarbonate buffer system. So the higher the partial pressure of carbon 4 oxide, the lower the pH, and vice versa. The lower the partial pressure of carbon 4 oxide, the higher the pH of the body. So this is also very important in terms of management of patients who has changes in their pH for maintenance and management.